Good afternoon, everyone. Thank you for joining us and welcome to today's presentation. Today is Friday, October 4th, and I have the good fortune of introducing our micro webinar for today on Managed Care 101, a brief introduction. We have a small group of presenters for today that have graciously shared their time with us. I'm going to let each of them introduce themselves and we'll go ahead and get started. I will mention real quick that this is being recorded. So after today's micro webinar, this will land on our YouTube page, and it can also be found in our micro learning library on our website. Thank you, ladies. Welcome. Take it away.
Carol, you want to kick us off?
Sure. Hi, everyone. I'm Carol Mao, and I am with Iowa Medicaid, and I am the contract manager for Iowa Total Care, one of our managed care health plans. And Becky, I'll kick it to you to introduce.
I'm Becky Bloom. I am also an accountant or a contract manager with Iowa Department of Health and Human Services under the Iowa Medicaid Bureau or Division, and I oversee the WellPoint contract. Shannon.
Hello, I am Shannon Garland, and I'm the contract manager for Molina, and I am also with Iowa Medicaid. Joanie.
Hello, good afternoon. My name is Joanne Bosch, and I am the Bureau Chief for Managed Care Reporting and Oversight.
And Sarah.
And Sarah,
go ahead. Oh, I'm Sarah Peterson. I'm a dental contract manager, so I'm a dental contract manager for the dental plans.
all right. Thanks, everyone, for those introductions. We can go ahead and get started. And as Courtney shared, we're going over kind of a managed care 101 for those that are watching currently and also maybe watching this once it's recorded. So Becky, next slide, please.
Hang on, I gotta find the right button. Here we go. Do you get the next slide?
Yes.
Okay.
Perfect. Thank you. So just high-level overview about the definition of managed care plans. Managed care organizations administer the medical health plans. And then for our dental plans, those are referred to as pre-ambulatory health plans or PAP. And that covers the dental wellness plan for our members. And then when we use the term managed care plan, that encompasses both the dental and the health plans. Next slide, please. And I won't read through this, but here's everything that is included in our presentation today. We packed it full of great information for you all. We might not get to all of these points, but we will certainly share this slide presentation with Courtney to distribute. All right, next slide, please. All right, high-level Medicaid overview. The Iowa Department of Health and Human Services is the single state entity that's responsible for administering the Medicaid program in Iowa. And the agency operates this program through its Division of Medicaid. And the agency is also responsible for the Children's Health Insurance Program, or CHIP. The separate CHIP program is called Healthy and Well Kids in Iowa, or Hawkeye. We use a lot of acronyms. So hopefully we define them all for you here today. So back on April 1st, 2016, Iowa Medicaid transitioned to a managed care program known as Iowa HealthLink. And as a result of this transition, the model for service delivery and reimbursement changed from primarily a fee-for-service model to a risk-based managed care organization model. Today, the MCOs provide members with comprehensive healthcare services, including physical health, behavioral health, long-term services, and supports. And approximately 94% of all Iowa Medicaid members are enrolled in a managed care organization. And again, we're talking about on the health plan side right now, with the remaining 6% in the fee-for-service, which was the original program prior to managed care. Iowa's Hawkeye population is served by the same Medicaid MCOs and included in the total MCO population. And high-level overview, what is Iowa HealthLink? And as I mentioned just from the previous slide, it's a comprehensive risk-based approach. And the focus is on improving quality and access, greater accountability for outcomes, and it creates a more predictable and sustainable Medicaid budget. Our vision for the Iowa HealthLink is that a single system of care will promote the delivery of efficient, coordinated, and high-quality health care. It will enable all members who could benefit from comprehensive care management to receive their care through the MCOs, including our long-term care members. And changing from volume-based payment to value-based payment will allow incentives to enhance clinical outcomes or quality, including reduced duplication of services and unnecessary hospitalizations. And our goals, creating a single system of care which delivers efficient, coordinated, and high-quality health care that promotes member choice and accountability and healthcare coordination. You can see the different points, improve the quality of care and health outcomes for our members, integrate care across the healthcare delivery system, emphasize member choice and increase access to care, increase program efficiencies and provide budget accountability, and finally, holding our managed care plans responsible for outcomes. Our key goal is that Iowa Health and Human Services seeks to emphasize enrolled member choice, access, safety, independence, and responsibility while providing high-quality healthcare in the least restrictive manner. The program is intended to integrate care and improve quality outcomes and efficiencies across the healthcare delivery system, in turn decreasing costs through the reduction of unnecessary, inappropriate, or duplicative services. And how the program achieves quality outcomes, part one. And I'm just going to do this high level. I know we might be short on time. Holding MCPs accountable for cost and outcome creates incentives for, and again, those 3 bullets are listed, combining accountability for costs. And then Becky, if you can move to the next slide. Then it gets into kind of part 2 of how the program achieves quality outcomes. Again, we will share this information, but I'm going to turn it over. Becky's going to take over from here. Thank you.
Yeah, so we have several parts to the quality outcomes for the MCOs or the MCPs, and they're all included in this slide presentation that we have. But again, with a short amount of time, we want to make sure that we get through some more slides. So this is here for your reference. So one thing we do want to talk about a little bit here is who's included in the program, who can be included in this program. So it's the list is shorter for included versus excluded. So the majority of the Medicaid members are included in this program. Hawkeye members, Iowa Health and Wellness Plan, long-term care facility, and HCBS waivers are included in this managed care plan type plan. The list, I'll just name a few. There's a few population groups, I would call them, that are excluded from this program. Those would be people with a HIP program, PACE, that's actually at the member option, but medically needy persons presumed eligible for services, those are basically excluded from the managed care program. There are several services included in the HealthLink program, all traditional Medicaid services, including medical care in inpatient and outpatient settings, behavioral health care, emergency and non-emergency medical transportation, etc. facility-based services such as nursing facility services, intermediate care facilities for individuals with intellectual disabilities, psychiatric medical institution for children, mental health institutes, residential care facilities, and state resource centers. HCBS, you're all probably familiar with a lot of these terms. And then HCBS services such as the state plan, HCBS habilitation, and community-based neurobehavioral rehabilitation services, or the CNRSs. And we've provided links throughout this PowerPoint presentation too for your future viewing pleasure. And there are some services that are excluded. Dental services provided outside of a hospital setting, MFP grant services, and school-based services provided by the area education and local education agencies and infant and toddler providers. We do have pay for performance measures that we have set up for each of our managed care plans. Basically, there's a set of measures that are set up for the first year of the contract that the MCP might be new to the market. And then there's a separate set of measures for managed care plans that have been there for longer than 1 year. So the measures for managed care plans that might be new to the program focus more on operational and process metrics, such as measures related to timeliness and data accuracy to make sure that the implementation is successful. And in future years, we set different sets of measures. Measures are updated based on baseline performance and areas that we would like to focus on for improvement. Final state fiscal year 26 capitation rates established prior to the start of the contract will be calculated in consideration of we call them P for P, pay for performance measures that we have set for each of the managed care plans. We operate under several federal authorities. I'm not going to list them all. They're all here and available for you to review once you get this PowerPoint presentation. And we have Iowa HHS oversight. We have several areas of oversight over us in the plan of the managed care plans. So the Iowa Health League contracts have remedy options in place to address compliance issues. We have also included liquidated damages that outline what remedies will be applied in various compliance situations. Our intended goal is clear expectations and transparency. And basically, it's just pure oversight over the contract. You know, the managed care organizations or managed care plans signed a contract to adhere to all of the contract scope of work that is laid out for them. We are also we have oversight over us as well. The Health Policy Oversight Committee, the MAC, the Medical Assistance Advisory Committee, the Council on Human Services, the MHDS Commission, and our Ombudsman's offices. And we have several operational groups that we have established to help us measure and make sure there is success in each areas of the contract with the managed care plans. We have a claims and benefits work group. We have behavioral health work group, encounter data, urgent member, Medicaid quality committee that's for program improvement. A monthly interagency communication integration, and we have various other specialized work groups as needed. And anytime anything comes up that we identify that could benefit from having a work group on it, we will get one on there going. So we have if you haven't been out to our the HHS website, there is a dashboard that Joanne's team has created, and it's huge. If you haven't been out there to review it, it has so much information that it's very user friendly. You can go out there and find information basically on anything you're looking for. This is a picture, I think, of this is the main screen, right, Joanne? Yes.
Yep, that's the landing page.
Screen. So. And there, I believe, yeah, so we have a link to the dashboard. I'm trying to hurry, I apologize. So this actually allows access to the MCO and the Iowa Medicaid data, enhanced data analysis capabilities, and oversight of the managed care plans. I will let you guys go in there and play around with it. It really is good information to have. And of course, Courtney, you or your people, if they've got any questions, they can let Carol or I or Shannon or anybody know. So. And here we just put some links to resources. Here are the contract managers' email addresses. And then there's different websites that we have out here for you guys, links to websites that are helpful.
Thank
So
you for
now we're going to move to Sarah. Sarah, so sorry, hopefully I left you enough time. So
Yes, I think so. A lot of some of the slides are very, very similar. So we'll probably we can skip over some of them, but
all right, you tell me to skip.
Yes. So we're just going to talk about kind of the same thing, but on the dental side. So you can skip to the next, Becky. So just to give you a little bit of an overview, on July of 17, Iowa Medicaid or Iowa HHS combined dental benefits for all adult enrolled members into one dental wellness plan delivered through that pre-ambulatory health plan. So prior to 17, all members were on a fee-for-service plan as they were on the medical side prior to 16. And then children were provided dental services, still continuing through that fee-for-service basis under the age of 19. And then we had Hawkeye for children to receive dental coverage through a pre-ambulatory health plan, which was Delta Dental. And then we also have and continue to have a Hawkeye program that is dental only for children with third-party liability coverage. So child that may have medical coverage but does not have dental coverage, let's say through a parent's employer, they may be covered through the Hawkeye dental only program. And then in July of 2021, all children were then moved under 19. They transitioned from a dental fee-for-service system and started receiving dental benefits through our currently contracted dental plans, which are Delta Dental and MCNA. So kind of the reason, I guess, behind that was we wanted to enroll those children to better coordinate dental care for them and promote oral health in accessible and cost-effective manner. You can skip to the next one, Becky. And I kind of already explained like the types of coverage that children and adults have through Medicaid. So there's the dental wellness plan, both for children and adults. And then we have the Hawkeye program, either the combined medical and dental coverage or the Hawkeye dental only that I previously just talked about. And just like the medical, our medical plans, we have the federal authority that kind of regulate what we do as a state for the dental plans as well. So those are the three federal authorities. And then our dental plan vision is really to build stability for Iowa Medicaid members and providers by coordinating and integrating care for them, improve quality outcomes and efficiencies across the healthcare delivery system, and decrease costs through reduction of unnecessary, inappropriate, and duplicative services, which is very similar to the medical plan's vision. And I mean, I believe the dental goals are very similar as well. So improve network adequacy and availability, increase recall and prevention services for members, improve oral health equity among our members, and improve the coordination and continuity of care between managed care plans. So not just dental system to dental plan, but having that continuity of care between all plans, and then enhance the medical dental integration. And I believe this key goal is the same for medical and dental. So Carol, I believe, already kind of shared that, so you can skip that. And I think a lot of these quality outcomes are also very similar. So holding those managed care plans accountable for cost and outcomes creates incentives for them to do all of these things, and combining the accountability for cost and outcomes enables, that the managed care, like their payments are tied to outcomes rather than just fee for service. And this is the quality outcomes, the part 2, which I believe is the same as the medical plans there also. And then the quality part 3 for like your member benefits. So we actually use an oral health equity like self-assessment tool for enrolled members. It captures their oral health status and needs, and it also incorporates their, some social determinants of health, which allows the plans to really tailor what that member needs to try to help them access services. And then that link there will give you what services are included within the dental program for the dental wellness plan. The Hawkeye plan for children is very similar to the services provided under the DWP program. And then also the EPSDT, we provide all, the comprehensive array of services for infants, children, and adolescents under 21. And this just lists what's not included in our plan. And this just gives you a little bit of like our HHS oversight, which for the most part is the same as what is oversight for the medical plans. And then some key groups. I will say the ones that Becky mentioned, some of those are also part, the dental plan also is part of those work groups as well. But I would say the town halls the Medicaid town hall we have member and provider town halls that have also been established to align Medicaid with national best practices. So if you're not a part of those now as a provider member, I would suggest there's a lot of opportunity for members and providers to let leadership know what's going well or not well and kind of get those needs addressed that way. And then our dental stakeholder work group that was held in fall of 22 was really used to determine what inefficiencies were seen when referring members to their oral health needs. And it was used really, the feedback was used when we are developing the RFP. I think that's it.
Yeah, that's it. Courtney, I don't know.
No, that was wonderful overview. Thank you.
It was fast and furious. So if there's any questions you have for us.
In the micro webinar, you guys did great. And I love the collaboration. Thank you for coming together to do this. There weren't any questions in the chat. But I do want to thank you also for the links that you provided. I'll make sure that those get uploaded to our micro-learning library, that those links are available to folks, as well as the PowerPoint and the recording itself. Wonderful information, very helpful overview. Thank you very, very much for making the time today to come together and do this presentation for us. I will also make sure to include your contact information in case folks have any questions, okay?
Sounds great.
Good.
Gosh,
Thank you for having us.
Yes, thanks again and enjoy the rest of your day. Have a good
All right, you too. Thank you.
Thank
Bye.
you.
Bye.
Bye.